and engagement process as well. That's important. And I encourage you, I'm sure you are, but I always like to I highlighted it with my staff last night, the importance of this venue, of being here and having access to the grantees, and you as grantees having access to us, to ask questions or to engage, to learn. That relational piece of it is critical. But as we look at things, we're looking at it from the context of the law, the RIE Act, the FOA, those types of things. When we are on site and we're working with you, or we're talking with you throughout the life cycle of that process, we're not working and operating from an opinionated basis, right? And I kind of talked a little bit about this in a session yesterday in regards to, you know, from the federal perspective, we've got this framework that we put out, but we don't prescribe it. So you know your kids, you know your community, you know the demographics, the resources that are going to work, and that's what we're here to support that. And so what we see as maybe something that would work is not maybe necessarily going to be successful at that local level. So that's why it's critical for us to come in and engage with you on that and look at things. And where there are things that we need to learn from and grow from, that's what we're hoping to achieve through this. So organizationally, out of these that we visited, about a third had some challenges with the fiscal responsibility. That might be oversight or accounting. If you're an agency with multiple streams, right, it gets very convoluted. And if there's any accounting folks in here, right, and those that aren't accounting folks, if you look at that spreadsheet, it's like, how does all this, you know, work together? But that's critical and a requirement. So some challenges with that. Personnel records, about half, and most of that is with background checks, training, documentation, those types of things. Programmatically, eligibility has been a struggle. Eligibility in regards to age, in regards to the reason for, the impetus for coming into the emergency shelter, their status as a runaway and homeless youth versus respite care, versus family homelessness or medical need of family, those types of things. Residential capacity has to do with the actual number of beds, the ability to have 24/7 access, the number of beds and access. Aftercare, we've noticed this here in the last year. Well, it's been an ongoing thing, but really had in the last year and a half, really looking at it internally from programmatic policy piece of it, on addressing this. We know that from feedback from you all and looking at things that aftercare is a big piece of a gap, right? Because when they leave, you know, you have a phone number, but you call that number and it's no longer in service, or they may move or go somewhere else, and it's just a breakdown of that. So it's difficult to provide those aftercare services. We also talked here in the last couple of years on what aftercare really is, and we're seeing, you know, kind of a slow transition to understanding and addressing that within your programs as well on the continuity of services that they received with regard to aftercare. Opportunities for improvement. So whenever we're on site, we don't want the interaction to just be one-sided. So it's a discussion. It's an ongoing discussion. It doesn't stop when we leave either. And so for the opportunities for improvement, it's one piece that we've incorporated into our report that we provide back. And again, these are things that, as we look at it, there may not be a non-compliance issue, but it might be something that if unchecked or if unaddressed, it could lead to a compliance problem. And I'm more speaking to things that we have here. So, excuse me, for staff and board development, it's a matter of, again, the training, the requirements of training, the background checks, the supportiveness of that. And then for board development, it's really kind of speaking to the cultural diversity of the board and the establishment of a board that's going to be reflective of your community. It's going to provide you the necessary guidance and leadership that's going to be addressing the services and programs that you're engaged in. Programmatically, youth assessments and case planning. So that's a part of the intake process of assessments, ensuring that they are eligible for services, assessing for their health needs, assessing for other follow-on services or services that they need to be engaged with, education, right, health benefits, those types of things. Case planning is the long-term life cycle of their services that you're providing. The documentation is a big piece. We're talking about, again, if it's not there, it didn't happen. So we know that the work is being done because we see the results. We see the data. We see, the reports and see what's going on. We talk with the kids. But the documentation piece is something that needs to be strengthened, the quality assurance piece of it, understanding correct documentation, the planning, the treatment, that whole life story of that youth coming through and receiving the services. Life skills curriculum, just kind of strengthening that. A lot of people do it, but there are a lot of different models out there. There's a lot of evidence-based and efficacy-based models that are effective and can be implemented as well. So it's an opportunity, again, to strengthen what you have. Youth involvement, that's a little bit about the positive youth development. I talked about the mentorship, best practice thing. But it's really that concept that we've heard here in the past about, for the youth, nothing for them without them. It's just really an intentional, we talked about here with Nola earlier, right, on the intentionality of being invested and engaged with those youth and hearing from them on what's needed for them, not cookie cuttering everything to that piece. And community engagement. We spent a little bit of time again looking at that, and we've talked about it at our regional trainings as far as capacity building, community engagement, sustainability, things like that. It's, as you know, our funds are not forever funds. They're also not a large pot of money. So it's really about how do we engage with our community leadership, with our community as a whole, to sustain us and stable us moving forward. Okay. So some monitoring, oops. Oh. So monitoring improvements, right? We're celebrating 45 years, and we know that, with age comes wisdom, with wisdom comes insight and perspective, and so we're constantly looking at how do we improve ourselves, how do we strengthen this process. And so one of the things that we introduced 2 years ago was monthly contacts, making sure that we're connecting with you on a monthly basis. On-site monitoring instrument, we've created a tool for us, the FPOs and the peer monitors that we use to evaluate that, and standard procedures for that. We're formalizing, moving into this year, a validation visit. So if there were some non-compliance issues, there's a follow-up process to that, and there's a report process to that. Again, to ensure that we're providing you as much support as we can, and where we can, then connecting you with like RITAC or other agencies that have had similar challenges and overcome those, that are coming from a similar type of program or community, urban, non-urban type of thing, and being able to strengthen that process through peer-to-peer interactions. And then the 360 evaluation is something that we started this last year. And that essentially is what it says. 360, oops. 360. Where is our information? Oh. Can you help me with this? That's why it's going back.
Which one are you trying to get to?
Go back. I mean, go to 360. There we go.